Hi there. My name is Dr. Richard Godby, and I'm a hematologist at the Mayo Clinic in Rochester, Minnesota. I'm very excited to talk to you about AI-enabled health ecosystems and how AI is impacting clinical care. For more information about me, please feel free to follow the QR code on the screen. In particular, I'm really interested in how patients are using AI or artificial intelligence to become the CEO or the head of their own healthcare and being empowered through AI to help improve their healthcare experiences. And over the last year or two, the landscape has changed dramatically from using search engines to using reasoning engines with these widely available large language models. So even just a year or two ago, most patients had to use a search engine and bring all of their research and questions together by following lots of different links and trying to read through many pages. But now, with large language models, patients often are going to these to ask their most complex questions and getting really good sounding answers in return. And in fact, some data show that there are millions of people using these large language models for health questions specifically, with billions of messages sent every week to try to better understand their healthcare. I think an important concept to understand is that not all AIs are created equally. So right now, a lot of people have used or tested these general AI chatbots or large language models, things like ChatGPT, Google Gemini, Llama 3, Claude. There are several out there that people use quite often. And they're used for general lifestyle questions, drafting emails, and all sorts of other uses in everyday life. However, there's a little bit of a risk when we use these for whatever purpose, but a particularly high risk when we use them for healthcare related questions. One of the reasons for that is they prioritize helpfulness over base truth or ground truth. There are other types of artificial intelligence that are attempting to use your personal data. I've listed some of them that have been in the news recently here on the right of the screen, such as ChatGPT Health and Claude Health, but these are still being tested and are very new. And so there are organizations and individuals trying to further validate and understand how well these types of AIs work. But the idea is that it would be integrated to your personal health information and be able to analyze your specific records and track different drug interactions and have a lot of context for your health. Additionally, the idea would be that these would be HIPAA compliant and that it would reduce hallucinations or fabrications that the general AIs might provide when having a chat about healthcare related problems, because it would be grounded in your healthcare data. So while the bounded or grounded health AI models are not widely available yet, a lot of people are still using the general and unbounded AIs for healthcare advice and to learn about their health. So AIs have a couple of superpowers that can really enable patients. The one is being a translator. Whenever there's a note from a healthcare interaction, sometimes it's really difficult to understand. Whether it's a discharge summary or a lab report, there can be a lot of jargon in there. And so patients can often use these AIs to translate that into much more to the point and understandable language. So for instance, if somebody wrote that there is neutropenia and elaborated on what that was in the report, the large language model or AI might just get to the point and say your white blood cells are low. And so this can really help not only understand what is being said at the healthcare interaction, but it also addresses what can be referred to as a post-visit amnesia, where there's a lot of different ideas being discussed in kind of a high anxiety situation. And so being able to go back to the reports and put them into plain language is really helpful for patients. The other superpower that AI has is being able to do longitudinal reasoning, connecting the dots over time. So whether it be changes in creatinine or changes in your hemoglobin or other changes over time, being able to have that context of change over time and not just a snapshot in time can really help AI put together a better story and understanding of what's going on with your health. Again, this might be something that comes a little more naturally once those integrated AIs are more validated and more widely used. But even in individuals who enter their personal lab values over time, the AI might be able to provide some context for what's going on. Another superpower to the AI is preparing for visits with your healthcare team. And it can take everything that you're thinking and feeling and put into it and convert it from a lot of subjective input to more objective input. And this can really help organize the visit, but it can also help make the most time of the visit. A lot of times, healthcare visits are very short, minutes to half an hour. And so being able to really bring out what's the most important things and talk about it in a structured way can really help make the most of healthcare visits. Another superpower of AI is interacting with insurance companies. AI can serve as an insurance advocate, whether that means drafting appeal letters, whether it means understanding complex billing codes, or even before choosing an insurance, being able to compare different plan benefits. AI can help synthesize all that information to make sure that the patient chooses the right insurance plan. And again, data has shown that there are millions of messages sent every week to simply trying to navigate the insurance process. And so by using AI, this can really be streamlined and become less of a burden for the patient, as well as healthcare institutions. There are many dangers with AI, particularly when it comes to healthcare. One recognized problem is the fact that AI often responds or acts as a yes man or a sycophant, where it will prioritize being helpful to whoever's asking it questions over getting to the actual medical truth. And so it may agree with whatever is put into it in order to be polite while not necessarily being accurate or true. There's also something called the trust delay paradox, where reassurance can be dangerous. And even though before AI, a general concept was that it took a lot of time to build trust, with AI today, a lot of people are trusting it automatically. And with that trust, they're delaying care inadvertently sometimes. So, for instance, if a patient had a really high fever while on chemotherapy, some general advice would be to stay hydrated and get rest. But in this specific context of somebody who's at really high risk with really low blood counts, they may have something called sepsis or a really bad infection, and they should actually seek treatment sooner than what the AI might be recommending. And so, a concept that folks are looking into and worried about is that high trust in AI can correlate with delayed care. And so, if it feels urgent, the patient should seek care and ignore what the AI is telling them. AIs can hallucinate and fabricate different ideas and concepts. And so it's up to the user to really verify what the AI is telling them. And even if the AI sounds confident, that doesn't necessarily mean it's accurate. So not only can AI hallucinate, but it can actually fabricate the sources and citations that it uses to back up its answers. And so users really need to check and follow those sources and citations to see if it truly supports what the AI is saying. Additionally, there's something called prompt fragility, meaning that small changes in the prompt that's put into the AI can significantly influence the AI's answer or the outcome. And there's this whole field of prompt engineering to better understand how to build prompts to get the correct and most accurate answers back from AI. Another part of using AI as a patient is to really understand that data hygiene is really important. And so when you're using these general unbound AIs, it's generally a good practice to avoid uploading things like your personal social security number or other personal identification. Instead, as the more grounded apps become available and validated within the electronic health record, that would probably be a safer place to use them. But in the meantime, if you're going to use general AIs to ask health questions, you should really try to make them your prompts as anonymous as possible. So, for instance, instead of saying, I have hemolytic anemia, you could say that a 50-year-old person with hemolytic anemia to try to reduce the amount of personal health information that you're sharing with these public AIs. And so a recent study that I found very interesting essentially showed that AI was able to answer medical questions kind of in isolation very accurately. However, when the team gave the patients access to AI or otherwise looked at how patients interacted with AI around their healthcare in the real world, the the accuracy significantly declined to almost 34% from 95% when tested in isolation in the lab. And so there's this real question of how to best use AI and how to best work with patients to use AI to get better answers. But as of right now, according to this study, using AI was about as accurate as using that old-fashioned search engine to look into questions and get answers about your health. And so a lot of work still needs to be done to refine how patients and AI interface to get them the best and most accurate answers. And so a good rule is to always have the verification mindset. An AI output does not equal a definitive diagnosis, but rather a rough draft. And so it would be best to think about using AI to generate questions for your healthcare team and not just going to it straight for answers for your health in terms of being an absolute truth. And so an example might be instead of asking, do I have anemia based on your data, you might say, what question should I ask my doctor about these hemoglobin results? And so a summary is to select the right tool. Again, most people use these public AIs, and they're great for general ideas and follow-up questions. But if you're going to use them to look at personal data, try to keep that data as anonymous as possible. You should really think about the prompts that you're using with these AI models because they can significantly influence the output that they have. You should verify all the output and treat it as a rough draft, making sure to check all the sources, not only that the source is real, but that the source supports the point produced by the AI. And then bring the AI notes to your healthcare appointments in order to discuss with your team, but also to organize and to make the most of those appointments with your healthcare team. So there's always been this wonderful relationship between the doctor or the healthcare team and the patient. And now AI is coming into the picture. It's not only influencing how patients experience their health and learn about their health, but it's also helping healthcare teams and healthcare institutions bring better care more efficiently to more patients. And so, really trying to understand how these things come together in the real world and how we can help patients the most and enable them for self empowerment to understand more about their disease and treatment options, and also to make the most time of the appointments with the healthcare team and to optimize that relationship. It's going to really help make patient journeys clearer, safer, and more empowered. So thank you very much for allowing me to discuss AI and patient healthcare and patient literacy. Again, my name is Dr. Richard Godby, and I'm a hematologist. And more information can be found at the QR code on the screen. Thank you.